那从简简单单的自我介绍开始，然后我开始提
Hello, my
问。
name is ZehanChen, and this is my student number 221709181. And this is my job interview assignment. So let's go and get started.
Ready?
Yeah.
So we're going to start with the first question. So other registrars or no, which factors do you think are important for team communications and documentation? And also provide an example from your own clinical practice.
Yeah. So for question one here comes to my answer. As a registered nurse, I believe effective team communication, accurate documentation are essential for maintaining patient safety and continuity of care. So important factors including clear and timely communication, active listening, respectful teamwork, and accurate documentation, and also appropriate escalation and ensuring that the important clinical information is communicated to the right patient at the right time. So I will have an example to talking about when I have a patient during my central placement. I care for her for a post-laparoscopic cholestasis testing. And while assisting with a routine dressing check, I noticed that a small amount of the fresh bleeding around the port side. So as a student nurse, my role was to observe and report and consult to my supervisor nurse and assist with appropriate care while following the hospital policy and procedure. So I immediately to inform my supervisor nurse. Together, we assess the wound and confirm the patient who was under in she has a stable vital signs. And also, I help to reinforce the dressing documented. So finally, we found the dressing is not quite easy, and all the dressing is fine. And also, we will provide reassurance to the patient. So my supervised nurse escalates to the surgical team as per protocol to report what kind of situation or what the assessment we do for the patient, and also about the we also report to the wound CNC about this patient her post-operation surgical site situation. So, as a result, the bleeding was minor and self-limiting. So the surgical team reviewed the wound and was satisfied with the management. The situation reinforced the importance of attention of detail and prompt communication and teamwork in managing post-operation complication as a student coming to learn. So, I think this example to me is a very good example. Is a very good sample to show me about the good communication and on-time documentation. It's also not just administrative responsibility. They are also very important clinical tools and also as a source to for the team support and also to it train me about my clinical decision making, escalation of deterioration, and ultimately for patient safety. This is my answer for question one.
Okay, great. So now let's move on to question two. So how do the New South Wales Health core values of collaboration, openness, respect, and empowerment relate to your role as a registered nurse? And also, same, provide an example from your clinical practice.
So as a registered nurse, I believe that New South Wales Health core value of collaboration, openness, respect, and empowerment are fundamental to providing safe and person-centered and high-quality care for the patient. So this value guides how I communicate with patients, family, and also the multidisciplinary team for including and all of users. And also teach me how I respond to different perspectives and how I advocate for patient while taking responsibility for my own professional practice. So, during when I in my CCU practice, we have a new admission patient transfer from ED. And the patient initially the patient's situation is quite stable. All the odds was between in a flat, and all for her ECG is also in a sinus rhythm without any deterioration. But at one time when I talked with him, he looked very tired, diaphoresis. And I asked the patient, "Man, do you feel any discomfort or like heart pumping out feeling?" He said no, but I still have a basic clinical judgment about it might have some cardiac issues for her. So for him, so I asked my body arm to have a observation for him, especially for her BP and for her heart rate and blood pressure every 15 minutes. And after that, uh we found that her situation goes down very quickly. And finally, we found there's something wrong with him. We immediately to apply the PRN on everyone and also other medications to control her cardiac situation. And we sent him to the ICU ward, sent him go back to ED wards to recheck again. And finally, we found that the diaphoresis reason for him is come from she is under for is come from that he is under a mitral regurgitation situation. So uh, uh, hopefully, the patient finally will become stable. And at the time when he finished his journey in and coming back to CCU, he showed not great gratitude for me about I detect the situation very quickly and we very quickly report to the whole team so we can help him to save his life. So I think it's a very good example for me to apply all the values to my daily patient centered care. And I believe that living in this core value in my everyday practice allow me to work effectively as a part of a team and also provide smooth workflow with my colleagues and maintain patient safety as well. Yeah, this is all my answer.
Okay, so last one. You know that this is against infection control policy and practice. What are the professional, ethical, or legal issues you would consider, and what actions would you like?
Yeah, if I witness a medical officer approaching a patient without performing hand hygiene, I will recognize that this is an infection prevention and control concern and to potentially place the patient at risk of a healthcare associated infection. Professionally, I have a responsibility to maintain safe nursing practice to speak up when I identify a potential risk to the patient safety. Ethically, I have a duty of the care to protect patient and advocate for their well-being, while also maintaining respectful and professional communication with the MO. From a legal and professional perspective, I think that healthcare workers are required to follow the infection prevention protocol and also control standards and the policies in different hospitals. Uh, if the MO was appropriate, I will respectfully remind the medical officers to perform hand hygiene before examining the patient. For example, I might say to him, "Excuse me, doctor, would you mind performing hand hygiene before examining the patient?" I will use a calm and respectful approach and focus on patient safety rather than blaming or criticizing the medical officers. And if the medical officer he did not respond appropriately, or if I believe there was an ongoing or like significant risk for my patient, I will escalate the concern to the senior on or the non or the team leader on ground. And also, I will say that appropriate infection prevention and also to inform the infection control team according to New South Wales health policy. And I will also ensure that any relevant incident report or risk will be documented objectively and factually without making personal judgment or criticize comments to backbiting for the medical officer. It's for the fair. And overall, I believe I will speak up respectfully as a very important part of my professional responsibility as an RN. And also, I think on the other hand, protecting the patient from preventable infection requires every member of the fully multidisciplinary team to take responsibility for infection control and patient safety. So I think especially uh, prevent the infection from the patient safety is also to protect ourselves. This is for my whole answers.
Okay, thank you so much for the interview.
Okay, thank you so much. Have a good day.
好，关。